everyone, welcome back to our channel. Now, you have memorized the role play card and you have rehearsed your medical vocabulary. You're ready for the OET speaking test, right? But when you open your mouth, things just feel off. Maybe your sentences feel robotic, maybe you pause too much, or maybe you are just unsure if the examiner even understands what you're trying to say. Well, guess what? Today, I'm giving you the ultimate guide to OET speaking part 1, focusing on the linguistic criteria. That means how you speak, not what you say. So, we are talking fluency, pronunciation, grammar, and vocabulary. And you will walk away knowing exactly what the examiners want and how to deliver it with confidence. So, get comfy, grab your tea or stethoscope, and let's dive in. So, what is the OET speaking test? It's just a quick refresher before we zoom in. You will do two role plays. You might be aware of this, right? So, each lasting about 5 minutes. You will play a healthcare professional like a nurse, doctor, or pharmacist. The interlocutor is the patient or caregiver, and you are judged on two things. First one, clinical communication and linguistic criteria. Okay, so today our focus is going to be on linguistic criteria. Are you ready? Let's dive in deeper. So, when it comes to linguistic criteria, there are four main categories. The first one is intelligibility. So, can we understand you? That comes as intelligibility. And fluency. Are you smooth and natural when you're speaking? How the flow is? That comes into fluency. And appropriateness of language. So, whether your words and tone suitable and appropriate for the context that you're using. Next comes resources of grammar and expressions. So, are you grammatically accurate and you have varied expressions? So, these things we are going to unpack one by one with examples, pitfalls, and strategies. So, stay tuned. The first one is intelligibility. So, this is all about pronunciation and clarity. I'll tell you a bad example how it should not be. Ma'am, I think we will check your pressure and see if you have hypertension. It's very hard to follow, right? It's missing sounds and your terms are very unclear. It's very difficult to follow. So, how you should speak. Ma'am, I think we'll check your blood pressure to see if you may have hypertension. Does it sound good? Yes. So this sounds clear and at natural pace, isn't it? And here are some strategies to improve yourself. First, you need to record yourself and listen critically. Just try to listen carefully, appropriately, and try to self assess yourself. And you can use tools like Elsa Speak or Youglish. Observe how native speakers link and stress words. That is pretty important. And focus on th sound, sounds, and also ending sounds, which would be very important when it comes to linguistic criteria. Okay? The next one is about fluency. When we talk about fluency, it's not about speed, it's about the flow, right? How logically you're able to connect the words, phrases, or sentences, and how your word order or the sentence flows in a natural way. So it's okay to pause, but try to do it in a very natural way. And don't be robotic. Say, for example, if you're speaking like, I will now give you some advice. No, it's not right. Just speak it in a very natural tone, like this way. Now, I'll give you some advice that can help manage your symptoms more effectively. So, here are some strategies to improve your fluency. Practice chunking. Okay, speak in phrases, not word by word. You need to practice this efficiently. And try to use the fillers smartly. Say, for example, let's see what I can suggest is one option you might consider is so these are some of the phrases or the fillers that you can use when you're speaking to your patients. And try this exercise. So, read aloud while walking to develop the rhythm. Fluency improves with rhythm. Okay, you can try out this exercise. The next one is appropriateness of language. When we are talking about appropriateness, this one is a little tricky. It's about tone, politeness, and matching your language to the situation or to the context. So, if you are speaking too casual, hey, your kid's got asthma, give him meds. No, that's not the right way. And if it is like too formal or if you're using too technical words, that is also an incorrect one. Say, for example, the child presents with bronchospasms triggered by environmental allergens. The patient might not have any clue about what you're talking if you're speaking too formal or too technical. So speak just right. It seems your child may have asthma, which means his airways are very sensitive. I'll explain how we can manage it. This is the right way to talk, isn't it? And here are some strategies. Try to use empathy phrases. That's pretty important, right? When it comes to healthcare setup, I can understand this must be worrying, or you can say, like, it's completely normal to feel anxious about this. So, this means you're showing your empathy, you're acknowledging their fear or concerns. Avoid slangs or excessive medical jargon. Don't use too much of technical terms, which is not necessary or appropriate. Soften suggestions. What I would suggest is, would it be okay if we try? So, even if you are giving some suggestion, try to make it in a softened way, in a very polite way, asking their opinion or their perspective. The next one is resources of grammar and expressions. So, when we are talking about resources of grammar and expression, it refers to the sentence structure, the appropriate uses of tenses in an accurate way and with varied expressions wherever it is required and avoiding grammar slips. Okay? If you're speaking with a bad grammar, say for example, she don't take medication regularly. She no wanted. No, that's incorrect, right? It's not grammatically correct. You have to speak in such a way, right, with a proper and accurate grammar. She doesn't take her medication regularly because she doesn't want to. Got it? So, here are some grammar tips that you can practice. Try to use complex sentences. Like, although you have been feeling better, it's important to continue the treatment. So instead of giving pauses between short sentences, try to use complex sentences. And try conditionals. If you experience any side effects, please call us immediately. And try to avoid repetition. Like, try to learn synonyms. So, for the word pain, instead of using the word pain again and again when you're explaining it to the patient, you can use the words such as discomfort or aches. And for medicine, you can say, like, treatment or prescription based on the context. So, your aim is not to speak in a very perfect way, but it should be clear, correct, and with varied expression. That's pretty important. So we'll see a sample role play and how we are going to apply all the four criteria in our next video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye-bye.